Dr. Bonham. How you doing today?
I'm doing all right.
Good to see you. Can I borrow your mind for a moment?
Sure.
Okay. Well, you know, we're in the midst of a pandemic. Hopefully we're on our way out of a pandemic. But we still have a lot of hesitancy in the community surrounding vaccination. And there's many different reasons for that. But one of the things that was, kind of bothering me as of late was how sometimes you can get mixed messages from the CDC or the FDA. So being a doctor, being a professional, who do you listen to first, or who carries the most weight when it comes to the CDC and the FDA?
So that's a good question. The FDA's job is to determine the safety of medications, vaccines, tests, that kind of thing, and they, approve them. And so you probably heard a lot about the vaccines having emergency use authorization, and some of those Pfizer's FDA approved now fully. That'll be coming for Moderna and Johnson & Johnson as well. There's a new medication that is an actual treatment for COVID that has gone to FDA for approval. And so that's really the bulk of what they do. The CDC's job is to say the schedule. So when do you get the vaccines? Is it, going to be every 6 months, every year, that kind of thing? They determine the schedules for really all of the other vaccines. They're kind of who we look to for that kind of guidance, because once these are approved, for the most part, FDA's job is pretty much done. But in terms of mixed messaging, that isn't necessarily the case. Science is a evolving thing, and so we're always doing studies and learning more. Okay. And as we learn more, then we give that information to the public. Whenever you do a study, you always want to try to replicate it and make sure that it's accurate. Scientists, physicians, all use the scientific method, and that requires you to kind of go back, look at what you did wrong, what you did right, and really go from there to be able to give good guidance. But what we do know is the vaccines have worked incredibly and saved countless lives at this point. So hopefully we'll be able to get more confidence back with the public and get more people to feel comfortable with getting vaccinated who haven't already.
Okay. Well, I'm glad you said that, because I wanted to kind of shift gears just a little bit with the convo, because when you think of vaccine hesitancy in our community, in the Black community in particular, there's a lot of conversation around trusting doctors. So if you're trying to get me to be on board, to trust the science, to trust the information, how would you do that if I'm someone that is kind of anti-vaccination or anti-doctor?
Yeah, I think it's just relationships. I always try to get people to understand that I'm just here to educate. And then when they have the information, it's up to them to make a good decision. Right. I don't think we can come in necessarily and tell people what to do in every situation. But usually people are reasonable. If people have good information, they usually make good decisions. The problem now is a lot of people have a lot of bad information, whether it be social media or word of mouth or any of those kind of things. And so I usually just recommend talking to your doctor. And if you don't have a doctor that you trust, find a new one, because that's a pretty important relationship to have. Right. But find trusted people, expertise that you can pick the brain, ask the questions. Yeah, that's really it. I think in our community, a lot of that lack of trust goes back 400 years. And I don't think we're gonna fix all of that during the pandemic. But I think that this is a start. There's a lot more effort going to, educating historically marginalized communities, Black people, poor people, Hispanic people, Native Americans, and we have to continue that work even after the pandemic's over, because, something else will come up at some point that we'll be able to pivot to, whether it be treating diabetes in our community or hypertension. All of those things all come back to trust and, understanding your medicines, understanding treatments, that kind of thing.
Okay. So, since we're talking about trust and trusting doctors and healthcare workers, there is a group or a faction of healthcare workers that are hesitant about taking the vaccine themselves. So if I'm on the outside looking in and I see a nurse that's hesitant, if I see a doctor that's hesitant, that's gonna make me hesitant. So I know that sometimes when we see the news feed, the numbers that we see can be a little skewed and it can be blown up or blown out of proportion. So is that being blown out of proportion, or is that a very real thing that is going on right now?
Unfortunately, it's real. I think whether or not it's being blown out of proportion a little bit depends on which numbers you're seeing, but it has been an issue. And I think the important thing to take from that is that healthcare workers aren't immune to misinformation and the power of social media. We all want to fit into a tribe, be a part of a team. Unfortunately, that has made some people choose to not want to get vaccinated right now. My hope is that changes. A lot of healthcare workers have seen exactly how much damage this virus can do to someone's body, but I think that people don't always see themselves in that. If you've taken care of a lot of older people, some younger people may think, this isn't a big deal for me, or I'm not high risk. There are also people who think that because they've had COVID in the past that they're safe or they have antibodies so they don't need to get vaccinated. There's still a lot of research going on to find out the real answer to that. I have had patients who have gotten COVID twice, but we don't really know what the real risk is. We don't really know what antibody level someone has to be at to be considered immune for every variant going forward. As this virus changes, unfortunately, a lot of people are going to find out the hard way that they should have taken their vaccine.
Wow. So when I think about the vaccine and people being vaccinated and the reasons why they don't get vaccinated and the whys and the reason why they do get vaccinated, how safe is the vaccine in comparison to, let's say, the series of vaccinations that my newborn baby may receive?
Just as safe. The different side effects and issues that a lot of people have heard about are incredibly rare. But there are always potential issues with anything. What we have to always keep in mind, though, is that the effects of COVID are much worse for more people than any effect they may have from the vaccine. And so when I got my vaccine, I had a fever, body aches, didn't feel very good for about 8 to 12 hours, and then it was gone. That is your immune system working. When you start making antibodies, you're gonna feel it. You may not feel very well for a day, but that's really common, and even that's very age dependent. Usually younger people are gonna feel that. Older people, they aren't usually gonna have that big of an immune response, and so they may not feel bad at all. And that's why they're the population who will also need the boosters first, because they don't have that big immune response. But in general, I said the vaccines are overwhelmingly safe. We have hospitals full of unvaccinated COVID patients, but we don't have hospitals full of vaccinated patients right now. And that tells us that we aren't seeing people hospitalized for vaccine issues or side effects. We aren't seeing a lot of patients hospitalized with COVID who have been vaccinated. Now we see people who get COVID that are vaccinated, but most of them aren't sick enough to need to be in the hospital. And that's the whole point in the vaccine, is the prayer that people will survive and be okay, if they were to get COVID after being vaccinated.
Okay. If I find myself at this point in the pandemic, coming out of the pandemic, and I find myself not vaccinated, why should I at this point?
Because I wouldn't say that we're coming out of it. I just say we're coming out of a wave. We really don't know how long the pandemic goes on, because a lot of that also depends on the rest of the world being vaccinated, and we're all gonna have to come out of this together. And so that's the reason, because we don't know. But the one thing that people can do to protect themselves, protect their families, protect the people they care about is get vaccinated. And we want to make sure that people don't have issues down the road, because we don't know that COVID is going to go away. And so just because people made it through 2020 and 2021 doesn't mean they make it through 2023 without having significant issues.
If I find myself with a positive test and I come down with COVID, so what do I do? What's the steps that I take?
So first, we have tests at home and those kind of things that you can buy over the counter. But I would say if you test positive, call your doctor.
Okay.
Because there are antibody therapies that people can get, and they work great. In some areas, they require that you have a medical problem like diabetes or, lung, kidney problems or those kind of things, or be overweight. But in some areas, it doesn't really matter. It just depends on the rules of that hospital or office. But that antibody therapy, if you get it within the first 7 to 10 days of when you have symptoms or get diagnosed, it has done wonders for keeping people out of the hospital, from getting significantly sick, any of those kind of things. And so we have recommended it for even some vaccinated patients to make sure that, we keep them as healthy as possible, even though they may have been diagnosed or been exposed.
So this question is surrounding quarantine. Some people are quarantining for 5 days. Some are quarantining for 7 days. What is the length of time that we should be quarantined? If I'm a father and I come home to my wife and my son and I'm positive, then how long should I be quarantined at this point?
So if you are not vaccinated, then definitely quarantine for 10 days. If you are vaccinated and you don't have any symptoms, then with an exposure, you get tested in 3 to 5 days. If that test is negative, you don't have to quarantine for an exposure. If that test is positive, then you also do the same 10 days. And so we have people sometimes who are vaccinated who say, oh, I found out that my friend I was with yesterday has COVID, what do I do? And that 3 to 5 day test is how we kind of figure it out. But up until that point, you do not have to quarantine.
All right, we are in a barbershop right now. And, I know that some of us are kind of getting tired of wearing the mask and tired of sanitizing the hands and tired of social distancing. This barbershop is not the largest barbershop. So if you could kind of speak to us staying the course, where we find ourselves at right now, because I'm a stickler for hanging in there until the professionals say, okay, you can dial it down or you can turn it back. So what do you say to those people that are kind of COVID overload at this point?
I'd say try to be patient. So there are 3 ways to protect yourself. I hear a lot of people say, well, you can still get sick if you get vaccinated. And that's true, but vaccination was never by itself. When you get vaccinated and you wear a mask and you socially distance, the chances of getting COVID are pretty close to 0 with all 3 of those in place. I can honestly say I've had quite a few tests. I've been antibody tested. I have not had COVID through the whole pandemic, thank God, because we know that those 3 things together work.
Right.
So I would tell people, we know that there aren't, significant long-term issues with vaccine at all, but we don't know what the long-term issues of COVID are yet. Okay. It took a really long time to find out that chickenpox could cause shingles, right, or that mumps could cause boys to grow up and not be able to have children. And so as we learn more about COVID, we'll know more about how the long hauler syndrome works and what downstream effects COVID can have. But in the meantime, masking, vaccine, distancing, those are the three most important things.
There's some conversations floating around out there around vaccines that have been approved by the FDA versus the ones that haven't. Can you kind of clear that notion up for us a little bit?
Yeah, so sometimes when I talk to people, it sounds like there's this idea that emergency use authorization is kind of a step towards full FDA approval. It's not really how it works. In 2001, when September 11th happened, George Bush, President Bush, realized that things just took too long when we needed stuff. And so the emergency use authorization came out of the Bush administration. It was a way to speed up the process when we needed a test or we needed a vaccine or just anything that may come up in the emergency, a pandemic, a war, any of that. This pandemic has really been the first time we needed it. But when Pfizer, the first one to go to FDA, submitted theirs, they had to make a decision if they wanted to submit for FDA approval or submit for emergency use authorization. They chose emergency use the same way Pfizer and Johnson & Johnson and even the companies who made tests, like Abbott and some of those companies. You submit for emergency use because if you do that, you can run your phase 1 and phase 2 trials at the same time. And what that means is you can do your studies on slightly larger groups than you would have first, because you have to do larger groups before you can say that it's safe. The other thing that it changes is they can go ahead and start producing it before they finish getting the approval. But if they don't get approved, then they just wasted a whole lot of money. Wow. But if they do get approved, then now we have it quicker. So if you remember when Pfizer got approved in December, they were shipping out vaccines the next day. And it was because they already got to work on it. So that's the only thing. The things they had to show for safety, the trials they had to do, all of that was the same. When Pfizer got their FDA approval, they didn't have to, do more trials because what they did first was adequate. It's not easier to get emergency use, it's just quicker. That's the only real difference. And so I would say to people, get whichever vaccine's available. They've all been safe, they all work.